Fantastic. I'll make a start then. So I just want to say hello and welcome to today's open event, where we will be providing you with an overview of our exciting health professions education and medical education MSc programs. Thank you so much for joining us. My name is Kate Thomas. I'm the events officer here in the Faculty of Medical Sciences at UCL and your chair for today's event. We're hoping this session will provide you with any questions that you have or provide you with queries addressing course-specific questions, help you to gain an insight into what it is really like to study health professions education and medical education at UCL. So this afternoon, our speakers, Miranda, Kerry and Rebecca, which you should hopefully see on the screen, will provide a summary of our exciting postgraduate programs, followed by a Q&A session with our speakers. So there'll be lots and lots of opportunity for you to join in throughout today's session. Just to let you know that this session will be recorded and will be made available following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. Now, to introduce our speakers, we have Miranda Cromfley. Miranda is Associate Professor in Teaching in Medical Education at UCL Medical School. Her teaching and research work focuses on postgraduate teaching and learning. She is committed to improving the quality of healthcare by facilitating effective learning in the clinical workplace through her academic practice in higher education. Also, Kerry Calvo. Kerry is Associate Professor in Teaching in Medical Education at UCL Medical School. She is the Continuing Professional Development Lead and a personal tutor for the postgraduate students on the MSc Health Professions Education and MA Medical Education programs. Her interests are online learning, curriculum development, CPD and faculty development, accessibility of learning, practical application of theory, academic and wellbeing support for learners and educators. And Rebecca Stellman. Rebecca is Joint Head of Education Development and Delivery at the Royal College of Physicians based at the Liverpool site. Within this role, she leads on the postgraduate programs that are delivered in collaboration with higher education institutions, including the Royal College of Physicians, UCL Masters in Medical Education, and she also leads the MSc year of this program. Thank you so much to all our speakers. Before I hand over to you though, we would like to run a few quick polls for our audience to answer. So I'll just launch those quickly. This is just for us to find out more about you and perhaps your reasons for attending today's event and thinking about applying for these courses. So as you can see, hopefully audience polls have popped up onto your screen. So the first question is just asking you where you are currently based. So if that's overseas or in the UK. We're interested in finding out a bit about your health profession. So please do let us know. We've got quite a list there. So don't worry, we're going to give you a bit of time to answer the questions. But yeah, we'd be fascinated to find out a bit about what's your health profession background. And also we are asking you about where are you in your clinical career? So we've got quite a few options there, but again, if it's not covered, please do press other and feel free to let us know in the Q&A if you are an other option, because we'd be delighted to hear your background and where you're at in your clinical career. And we're interested in finding out a bit about which program you're interested in applying for. So if you can let us know, that will be really helpful for our speakers, and we can then gauge kind of what your questions will be based around. And another question we have is, would you prefer online or face-to-face teaching? So we're particularly interested in this one because we want to know what you would like. Do you want a balance? Do you want all online? Do you want face-to-face? So yeah, any indication on that one would be fantastic. And the other points are just looking at what educational role do you have currently. So we have again got a list of options there. Please do, I can see that we have other people selecting others, so that's great. We may come back to you in the Q&A and just find out a little bit more about your backgrounds and your current role. What educational role would you like to have? We're particularly interested in this one because hopefully we can give you some insight into our alumni as well, so and career prospects, so that would be fantastic. Okay, I can see we have pretty much everyone that's participated. Fantastic. Okay, everyone's quite speedy, so that is wonderful. I'm just going to end that now and share those results. So currently we have 17% overseas that have joined the call, and 83% are based in the UK. And for your health profession, we have quite a combination actually. So we have doctors at 50% on the call. We have nurse, surgeon, and other. Okay, that's really helpful for us to know. Where are you in your clinical career? Okay, again, we have a combination. So at the moment, I can see mid-career health professional at 17%, speciality at 33%, consultation at 17%, and other again at 33%. Okay, great. So what I am actually going to do, I'm going to open the chat. So hopefully you could all access the chat, but if you clicked other, if you feel comfortable with sharing with us, please do let us know, and you can pop that in the chat as well for us, which would be very helpful. And which program are you interested in? So we've got a mixed combination again. So 17% health professions education, 83% medical education. And 50-50 for online and face-to-face. That's really interesting. So yeah, that's just really helpful for us to know. So thank you for submitting those answers. And what educational role do you have? So again, we have quite a mixture, but quite a high percentage for others. So I would be quite interested in finding out what educational role you have that's not listed there. So please do share that detail with us. We would love to find out. But the rest, medical educator, health professions educator, and the desired roles that you would like to have. This is what we like to see. So fantastic. Again, medical educator, perfect for the medical education course, I guess. So that's really helpful. Hopefully you're in the right place. And health professions educator, again, we're delighted to see that, and other. So please do feel free to pop any of your, if we weren't able to cover it in one of our listed options, please do pop that in the chat. We would love to hear from you. So I'm hoping that sets the scene well to hand over to Miranda and Kerry. So thank you so much, and I will hand over to you.
Hi everyone, it's nice to meet you. I'm going to hand over to Kerry, who's got some slides to show you to introduce you to our MSc in Health Professions Education.
Thanks, Miranda. So welcome everyone, and thank you for having us to talk to you. I'm just going to get my screen share on, and this is where my overlapping screens don't help. There we go. Okay, so this is talking to you about the Masters in Health Professions Education. Hopefully you can all see my slides there. Do pop a note in the chat if you're having any problems with that. And to give you an overview of how the programme works, it's what we call a flexible modular programme that you can take over up to 5 years. And what that means is that you can study part-time alongside your clinical commitments. Or if you have an opportunity to do something like an out-of-programme experience, you could choose to become a full-time student and take the master's programme over 1 year. Now, our programme at the moment is fully online. So we have that with both synchronous and asynchronous activities. And what we mean by that is that we will have quite a lot of small group work, synchronous sessions, and a chance for you to collaborate with one another. So very similar to what you would do in face-to-face sessions, but hopefully with the convenience of being able to do it from wherever you're based. And then we have asynchronous learning activities that you'll do in your own time again, so you can fit it around other commitments. But we do place a lot of emphasis on collaborative learning. And I think sometimes people worry that fully online means that you'll be doing distance learning by yourself, but that's not the case for our programme. And you can take the programme to either postgraduate certificate level, diploma level, or do the full master's programme. When you sign up for the full programme for the masters, but you can exit at any point with the credits that you've got, and you don't have to make that decision up front. So you can enrol and then choose later on. The other thing about the programme is that we have a number of different pathways that you can opt to follow. So you can choose to do our general Masters in Health Professions Education, which means that you can choose your modules from any of the menu that we offer. So you can really do a sort of pick and mix of the ones that appeal to you most. Or you can choose to follow one of our specific pathways. And those pathways are leadership, research, assessment, and primary care. And each of those pathways will have modules that are associated with them. And at whichever level you're at, PG Cert or diploma or masters, you would need to do 50% of your modules from the menu that go with that pathway. And the other 50% you can choose from any of the modules on the menu. If you're doing the full masters on a pathway, then your dissertational report also has to be in the area that you've chosen. So for example, if you're doing a leadership pathway, then your dissertation would be something to do with education leadership. So a little bit about learning with us. We have various ways that you'll learn on the programme. So there is a reasonable amount of reading to do because it is a master's level programme, but we also make use of other media. So we have quite a lot of videos. We make use of things like interviews. We're moving towards using podcasts as well. We have discussion forums where you'll share ideas with your peers. We also have things like peer feedback exercises where you'll do a piece of work and give dedicated feedback to one of your colleagues. We have collaborative documents or projects that you work on together, and that can be as pair or group work. And then we have our live online sessions where we get to do more discussion, debate, and lots of virtual face-to-face interaction. So one of the big things that comes up a lot for people is how much time do you need to study on one of these programs? And it is worth really thinking about this in advance, because you don't want this to be something that just causes you a lot of stress. So by thinking about it in advance, by planning some time to dedicate to it, then that should certainly help. So you should expect to use between half a day and a day per week per 15 credit module. So obviously double that if you're doing a 30 credit module. And that includes the time then for doing all of the work that's involved with the module. So that might be some synchronous stuff, it might be some online learning, it might be self-directed study, it might be reading, and then that will include things like planning your assignment. And as a rough guide, we would say that per credit, you should expect to do 10 hours of work. So one of the things we know drives learning is assessment. So we'll mention that briefly now. We have two types of assessment. We have the formative assessment for learning, which is where you get feedback on your module learning activities, and that takes the form of both peer and tutor feedback. And we will have some mandatory formative assessments in some of the modules. So you have to do them, but they don't contribute to a pass-fail for the module. And then for each of the modules, we also have the summative assignment, and those currently take the form of written assignments, essays, which we try and relate very closely to your teaching practice. So you'll have a topic where you'll assess one element of your teaching practice or something topical in teaching for you, and you'll look at that in relation to the literature. Now, there's a lot of support on offer for our students. Miranda and I are the two personal tutors for both of the master's programmes. So for anybody who's going to sign up to either the Health Professions Education programme or the Medical Education programme, we're the points of contact as personal tutors. You also have the Academic Communication Centre, who are really helpful at helping students to learn how to write academic essays, because lots of people, especially if you're coming from health professions, you may not have had to write an essay for a long time, if at all, for your previous assessment on courses. So they're really good at actually looking at a piece of your writing and helping you to learn to write academically, learn how to reference properly, and learn how to write critically, because critical writing is one of the things that's key. There's also the Student Support and Wellbeing team and Ask UCL. So Ask UCL is a general thing that we have on the UCL website, where you can just type in Ask UCL, and if you've got a problem, you put that in and it will direct you to the appropriate source of support. Student Support and Wellbeing team are absolutely fantastic, and they will work with learners who have specific learning challenges, neurodiversity, dyslexia. They can signpost towards the disability support team. They can help with financial issues. So anything that's causing stress, they're on hand to help with. So we have a really, really good support network at UCL, and all of these are available across both programmes. We also pride ourselves on having a lot of student involvement in our programme. So Miranda, I don't know, did you want to talk about this slide? Because this is one that I've pinched from you. So
yeah, it's just to talk about the way that we work closely with students to make sure that we draw on their input about their experience during their studies to develop the course. We have a little catchphrase for that called "Together we have changed," meaning really that we work with students to try and change things, and that those changes can happen during the course of students being on a module, because we actually take surveys from students, informal surveys from students during synchronous teaching sessions, and if there's something that's not suiting students on a module where we actually change it so that they have a chance to actually improve their own experience, as well as us taking on board feedback for the next iteration of modules. And we also work with students to kind of continuously find out from students what is the best channel for students to actually provide that feedback to us. For example, obviously during the pandemic, lots of things changed. So we just have lots of ways of working with students to make sure that we use your input. And this is just a sample of some of the things over the last couple of academic years that we've actually changed in terms of the way that we run the modules based on your feedback, or based on students' feedback. Thank you, Kerry.
Thank you. And yeah, this slide really just covers what Miranda was just saying there. So we have various ways of collecting our student feedback, and we really do, as Miranda said, we really do take that on board and constantly update and tailor things to make sure that we're meeting our students' needs. So it really is a very much a sort of collaborative way of doing it. It's also just worth thinking about, particularly if you're going to be self-funding and you're investing your money in this, what can you get from it? So where could an MSc in Health Professions Education take you? And these are just some of the roles that our previous students have gone on to do. So they may well go on to become a doctoral student. You know, you've been bitten by the education bug and you decide to go and do even more study. We've got alumni who have become educational supervisors, leads of curriculum, clinical academics, university lecturers. We've got people who are in trust education lead posts, training program directors, nurse preceptors, examiners for various health professions undergraduate programs. So and plenty more besides that. So lots of different opportunities. And I think increasingly people are recognizing the importance of qualifications in medical or health professions education for a lot of roles, and portfolio careers are becoming increasingly popular. So it really does help with those things. And then just finally, that's our email address to the admin team. Obviously, we'll be very, very happy to answer any questions that you have this evening. But if anything does come to you later, or if you want to have a chat with one of us about the programme, then please do email us, and we're very, very happy to set up a one-to-one chat with you.
Yeah, very happy to do that. And just to reiterate, we're really keen to support students who have particular career aims or general goals from the Masters with a personal tutor discussion, you know, once they are enrolled on the programme, to help kind of provide guidance, provide career support. So we're particularly interested to see the answers to those polls, but also just to let you know that actually we do want to keep in touch with you if you were to enrol on the programme as students about your career plans and how we can help with that.
Great, thank you. Thanks, Kate.
Fantastic. Thank you so much, Kerry and Miranda. And hopefully we've been able to answer some of your questions already. So now we will hand over to Rebecca.
Okay, thank you. So I'm just going to share my screen with you, hopefully. And yeah. Then hopefully you can see my PowerPoint. Oh, hang on. Oops. Okay, so I'm going to talk about the Masters in Medical Education, which is a collaboration between the Royal College of Physicians and University College London. So a lot of what Kerry and Miranda have already said about the way, the kind of support provided by UCL and so on, and the response to students kind of demands, or you know, their kind of views of the programme also apply to this programme. So I won't kind of talk about that type of things, but I'll talk about, I suppose, what makes this programme distinctive, and why, you know, why perhaps you might be interested in doing a Masters in Medical Education, and how it compares to the Masters in Health Professions Education. Okay, so this programme was established in 2002, with the first cohort joining in 2003. And it's established by Winnie Wade, who was then the Executive Director of Education at the Royal College of Physicians, and Dr. Jonathan Cartledge, who's a consultant and also academic lead for Year 5 of the MBBS programme at UCL. And it brings together two highly regarded institutions. So the Royal College of Physicians was the first medical college in England. It was founded in 1518 by Henry VIII to regularise the medical profession. And it's collaborating then with University College London, I would argue equally prestigious, founded not quite so long ago, but founded in 1826. And UCL's always been at the forefront of kind of radical thinking and practices. So it was the first English university to welcome students of any religion. It was the first to welcome women as well. So I think, you know, there's something very kind of exciting about UCL and about being a student at UCL. In 2021, UCL was rated second in the UK for research power in the Research Excellence Framework. So this collaboration brings together educationalists and clinicians from both organisations to develop and deliver a highly regarded and popular programme. So the overarching aim of the Masters in Medical Education is to enable doctors who are actively involved in teaching undergraduates and postgraduates in a clinical setting to adopt effective teaching strategies underpinned by educational theory and best practice in order to enhance the way that they support learning. So this, like the Masters in Health Professions Education, this is a flexible modular programme that can be studied over a period of 3 to 5 years. So it can't be done full time because you have to be in work as a clinician for at least some of the period of study. So it's a minimum of 3 years and a maximum of 5 years. And you, as with the Masters in Health Professions Education, you sign up for the full Masters, but you can exit early. So you can exit with a postgraduate certificate in medical education or with a postgraduate diploma if you don't want to do the full Masters. So I'm just going to talk a bit about, particularly about the first year of the programme. So unlike the Masters in Health Professions Education, we do not offer lots of different pathways. So, and in fact, the first year is everybody does exactly the same study. So there is a first module, which is called Teaching and Learning in Medicine 1, in which we introduce you to educational theory and research, and then the idea of getting you to think about how you can integrate your theory and your experience to improve your practice as an educator. You start collecting a portfolio of evidence of your educational practice, and you also start learning about how to read and analyse educational literature. And you do a short assignment, a critical literature review, as the assignment for that particular module. The second module, not very imaginatively titled, is Teaching and Learning in Medicine 2. And here the focus is very much on enhancing your teaching skills, how to encourage interaction from your learners, but we still keep going with that kind of strand of educational research. So you are developing your knowledge of theory and practice of educational research. And the assignment is a service evaluation study proposal. So it's a proposal for a piece of research. You don't actually carry out the full research itself, but you learn how to write a good proposal. The third module in the certificate focuses on educational supervision and clinical practice. So here it's very much thinking about how you apply educational principles to teaching in clinical settings, looking at, for example, opportunistic teaching, bedside teaching, teaching communication skills and clinical decision making. And this kind of links back to that portfolio that you'll have started in module 1. And you, for the assignment for this module, you have to write 2 short reflective reports on your practice as a clinical educator. So to reflect on your teaching and to link that into the theory that you've been learning in the course of the certificate so far. And then the final module for the PG Cert in medical education focuses on assessment and assessing learners in medical education. So key principles of assessment, formal examinations, more kind of informal or formative assessment, on-the-job assessment, and you actually critique an assessment that's used in medical education for your assignment. So that is the first year of the programme, though you can take more than 1 year to study it. If you want, you could do it over 2 years or even over 3 years or so if you want to. Okay, then you move on. If you don't want to exit with just a certificate, you move on to a postgraduate diploma in medical education. And this can be done in 1 year, but again, you could take more than 1 year to do it. And in fact, with the diploma, you can do these modules in any order that you want. So you don't have to start with module 5. The certificate, you do have to do the modules in order. And the curriculum for this master's degree is built on the kind of concept of what's called a spiral curriculum. So there's the idea that you're kind of in the diploma year, you are kind of revisiting and building on your knowledge that you've developed in the postgraduate certificate, but taking it to a higher level. So you are coming back to this idea of research methods, but it's a more kind of complex and in-depth study of research methods. Once again, we focus on teaching, but again, you're building on what you learned in the certificate and doing much more sort of sophisticated, advanced work about teaching. Again, clinical education, but now we call it advanced clinical education. And whereas in the certificate, you critique assessment, so a kind of component of a curriculum, in the diploma year, you actually look at course and curriculum design, so the kind of bigger picture of how learning and teaching and assessment all come together to make a course or to make a curriculum. And you are expected to write a bit more as well to kind of reflect the fact that you are working at a more sophisticated level. So once again, you have written assignments, but the word length has increased to 3,000 words. So 4 3,000 word assessments for the diploma. And then if you choose to do the full master's, what you then move on to do is supervised research in an area of your choice, an area of medical education. So you have some teaching, but it's much less teaching than you have on the certificate and diploma, and you're being supported by a supervisor in order to, and it culminates in a 12,000 word assignment. I put currently a choice, just in case things might change by the time you get to the master's year, but currently you have a choice between two types of master's assignments. You can either do what we call a research thesis or a research dissertation, when you actually collect primary data from participants. So you might interview trainees about their views on a particular mode of modality of medical education. But you can also choose to do what's called a report. We sometimes call that desk-bound research. And so that is where you review and analyse research that other people have done and published, so published studies, in order to answer a research question. So you get that choice at the master's year. So that's a kind of overview of the kind of, I suppose, the structure and the assessment methods of the Masters in Medical Education. A few practical matters. So this Masters, unlike health professions education, is delivered purely in person. Unless, you have a kind of train strike day, then we might switch to something online, because we got quite used to doing that, obviously, during COVID. But at its heart, this is an in-person qualification. So it's in-person delivery at the Royal College of Physicians in London. We have a baseline minimum of 66% attendance. So if there is a 3-day teaching block, you must come to 2 of the 3 teaching days. Obviously, ideally, you come to all the teaching days in order to get your money's worth, in order to learn effectively. But we appreciate that at times things happen which can make 100% attendance difficult, if not impossible. On the first 2 years of the programme, there are 12 teaching days, 4 3-day teaching blocks. So you'd come in, module 1 would be, for example, Tuesday, Wednesday and Thursday, and then a couple of months later, you'd have module 2, which would also be 3 consecutive days. The Masters, as I've already said, there's less teaching. You have 5 separate days of teaching spread out from around the beginning of October through to kind of early June. I think I've already touched on the fact that at the PG Cert level, all the modules are compulsory. So you have to do those 4 modules that I've talked about in some detail. At the diploma level, 2 of the modules are compulsory, the research methods and the advanced teaching skills. But then you have, if you some flexibility, you can opt in and study, if you want, other modules that are offered by UCL. Just obviously money is always something people are interested in, and I suspect the costs are the same for both masters, but currently anyway, the fee for the full masters is £16,000, but you're not paying that all in one go. Okay, that's obviously spread out over the 3 years, but it works out at just over £1,000 for each module. And what makes this quite a distinctive qualification is only open to those who've embarked on, who've gone through medical training, so doctors and surgeons. So I'm afraid it's not open to people from other healthcare professions, and that's why it's called a Masters in Medical Education. So we asked alumni from the programme about how the course has influenced their practice. I've just got a few quotations here about it being a game changer, help them develop as a clinical teacher, doctor and researcher, help them integrate education into a clinical career, gaining confidence, it's an asset to their CV, help with career progression, allows somebody to get a formal educational role. A few more here, somebody became a lead role in their specialty for undergraduates. It helped them gain a consultant post at a teaching hospital. Again, help them with an academic career. They ended up getting a role as postgraduate dean. They actually got invited to tutor and teach on the Masters. So we do have some of our alumni then come back to the programme and act as tutors or do some teaching for us. I think that's really nice when they've been a student on the programme prior to that. Somebody even got a role at the GMC and a clinical teaching fellow role. So I think, you know, hopefully it will show that with both these programs, actually by doing them, as well as the kind of hopefully the enjoyment of the study, it does open up opportunities for kind of career development and for specialisation in education roles. So applications for this master's close at the end of July, and there's an email address there if you do have any questions and you want to know a bit more after this session is over. So that's it from me.
Fantastic. Thank you so much, Rebecca. And I think we've got so we've got Kerry back on the screen. Fantastic. So we will go into the next section of this event. So now we will open the floor to everyone. So if you have any questions, please do pop those in either the chat or the Q&A function. And yes, I will kickstart actually, because I do have a question of my own for you both. So in terms of those applying, what are you looking for in an application and the personal statement? Do you have any tips or advice?
I mean, I think, you know, obviously we're looking for a kind of interest in and a kind of commitment to medical education and some experience of teaching, but, you know, we're not expecting people to be, you know, to have loads and loads of experience. But obviously to have done some teaching and to have some idea about kind of, I suppose, about why they like it, why it's important, why it matters. Kerry?
Yeah, pretty much the same for us. So any healthcare professional who is working with learners, and that can be pretty broad. So undergraduate, postgraduate, colleagues. So because obviously in other healthcare professions, it's not as clearly divided. So you don't necessarily have the formal postgraduate training as we do for doctors. And yeah, showing some enthusiasm, thinking of, as we look for people who've also had some thought about how they're going to fit this in, because one of the things that can be a challenge with any master's programme is that it is a lot of work. I don't want to put people off, but people find it much easier if they've just had a think beforehand about how they might try and factor that in. But you know, if you have any questions about applications, if you're unsure about, you know, what to put, or you know, again, do drop us an email.
I see there's a question about the fees for overseas students, so I don't have that to hand.
I can get that. Hang on.
Can you? Right. I mean, I see the fees will be the same for both programs because they are UCL fees.
I've also dropped in the FAQs section for so in the chat you can access the FAQs for health professions education. So it may be worth, if any of you are interested in applying for that course, to have a quick look at those as well. I think Kerry is typing the response to Shahina.
That would be great.
Okay, perfect.
So got the question about oh sorry, Kerry, you're the difference between HPE and medical education masters. Well, I think hopefully we did highlight, I mean, a key thing is the fact that you have to be a doctor or a surgeon to do the RCP, the Masters in Medical Education. So if you come from any other background, very sorry, but that you would have to be looking to the health professions education. So there's the difference in terms of eligibility.
Yeah,
also,
the health, sorry, go on.
I was going to say it's all in person as well for the medical one, and it's all online, isn't it, for the health professions?
Yeah. So the health professions education masters accepts any healthcare professionals. So we accept doctors as well as other healthcare professionals. We're not, we don't exclude doctors. So doctors get a bit more choice between the two programs. But I think the really big difference is that one of the programs is face-to-face, the medical education program is face-to-face, and the health professions education program is online. And so that modality of teaching is quite different, although both of them are collaborative, and both of them will have self-directed learning and reading that you need to do. So in some respects, they're less different than you might think. And I think then the other big difference, as Rebecca said, is that on the Masters in Medical Education, you have the fixed modules for the postgrad certificate level and for half of the diploma level, whereas on the Health Professions Education programme, you have more flexibility with those. So again, lots of the modules are very similar. But then you have the option of doing, if you're interested in leadership or research or assessment or primary care, then you can have a Masters in Health Professions Education brackets, leadership, for example.
I think, yeah, you can kind of tailor it a bit more than there's not that same idea that you can tailor things. But I suppose that's partly because we are just dealing with doctors and surgeons. We feel we don't have to offer that same kind of flexibility. Yeah.
Great. And we do have another question that it's coming from Jess. So thank you for your question. So that is, if taking the modules over several years, do they have set timeframes for finishing each module? E.g., is there a timetable for each module and you sign up, or is it fluid?
So you'd have to complete the module in the kind of time that the module's delivered in. So if, I was thinking, like, if a module begins in October, this is for the Masters anyway, medical education. So if it begins in October, the teaching would be 3 days in October. There would be an assignment due maybe end of November, and that would be then, in a sense, the end of the module. So you'd have to do it all in one go. You can't sort of split up a module over several months. What you can do is you could do the certificate if you wanted over 2 years. You could do modules 1 and 2 in year 1, and then perhaps you were busy in the latter half of the year, so you would put off modules 3 and 4 until say year 2. But the individual module has to be done in that self-defined time. I don't know if it's the same for you, Kerry, for yours.
Yes, so for HPE, we have, you would choose at the beginning of the academic year which modules you want to sign up for that year. It's easier to add additional modules than it is to take them back off again. So if in any doubt, sign up for maybe one, and then you can always add additional ones. And then once you've started a module, they run in generally in 8-week blocks. A couple of our 30 credit modules run over 10 weeks. And so you would be expected to do your learning within that time. So that involves the learning activities online and the synchronous sessions. And then you have a period of time before your assignment is due in. But having said all that, there is flexibility if something crops up. We know how busy everybody is in the NHS at the moment. We know how unpredictable it is. So if something happens and you're struggling, then both Becky and I sit on the extenuating circumstances panel. And if there's a problem, you can put in a request for extenuating circumstances, or potentially, if things get really bad, you can defer modules or whatever. So I wouldn't worry about that. But yes, generally speaking, once you've signed up to a module, you would do that, and then you sort of look over the course of the 5 years to see how you might want to plan out your journey.
Okay, great. Thank you both. And thank you so much, Jess, for your question. And if for any reason we haven't completely answered it, feel free to follow up as well. We are happy to cover anything else too. So we do have another couple of questions that have come in. So this is from Shahina. She is a consultant obstetrician and gynecologist with 15 years of teaching experience for undergraduate and postgraduate students of obstetrics and gynecology. What should be her option?
Either program would work very well for you. So it really depends on whether you prefer face-to-face learning, whether you prefer online, whether that's more flexible for you. if you want to go down a route where you might be, particularly if you're now a very experienced clinician, maybe a leadership route would be something you're interested in. But it very much, I would say, have a good look at both programs and see which one appeals to your way of learning, because both are excellent programs. Clearly we're biased, but you know, they both are very well taught. They do have a lot of similarities, and so really the big difference is that the medical education one is face-to-face and health professions education is online.
Perfect. Thanks, Kerry. And I'm not sure if this was addressed earlier, but in terms of the size of the tutorial groups, what sizes are those for both programs?
For the Masters in medical education, they tend to be about sort of, I don't know, between 4 and 6, but I think it's primarily in the Masters year, you'll have much more contact in a tutor group. I think the tutor group is different from the actual teaching size. So we can potentially, our teaching cohort could be kind of around 20 or so, but then you'll be divided into between 20 and 30, say, often, and we have 2 cohorts for the certificate. That tends to be a big year. And then we tend to have just 1 cohort for the diploma and 1 for the masters, because numbers do drop off slightly. But then within that, you will be also attached to a tutor. So you'll have a tutor in your certificate year, probably a different tutor in the diploma year, and probably a different tutor stroke supervisor in the masters year. And there'll probably be, each tutor will probably have, yes, between 4 and maybe absolute maximum 6 students. They won't necessarily spend that much time together in that group of 4 to 6. You're going to be spending more time in your kind of the teaching group of kind of, I don't know, could be, like I said, could be around 20, might be a bit more, might be a bit less.
And it, again, with ours, it varies a little because where we have quite a lot of module choice, sometimes that means we have slightly lower numbers per module, and it can fluctuate a bit. So usually we set our module maximums for 20, sometimes 25 on some of the modules. Again, you'll get a chance to work. We don't tend to have specific tutor groups. But what you will find across the module is that you'll be put into a group of 2 or 3 to work on a particular topic, or we'll be getting the whole group to do online discussion. We tend to run modules if we've got at least 5 people signed up to do them. So very occasionally a module won't run because we've not had enough interest that year, but because you're doing it over a longer period of time, you can always pick it up again in the future. It's rare that a module doesn't run. So usually anywhere between 5 and 20 on a module at any one time.
Fantastic. Thank you both. That's really helpful to know. We do have another question in the Q&A from Lara. So question is, do the synchronous learning sessions happen on the same day every week? I plan to use my day off from work in the weeks to study, but would need to plan my schedule in that. Would I potentially need to change my day off every week? So basically just helping to plan.
Yeah, plan time. So the synchronous sessions for the HPE program, it varies according to which module you're taking. And what we try and do is make sure that we don't have clashes across the modules, because it will be frustrating for somebody if they're signed up to 2 different modules and they're supposed to be in synchronous sessions for both of them at the same time. So those ones will vary. What normally happens is there will be a synchronous half day or full day at the start of a module. And then that's usually followed up by optional synchronous tutorial sessions or seminar sessions, which are normally an hour long. And sometimes they're on the same day of the week each week. Some modules, they vary. For all of the optional ones, they're recorded. And so if you aren't able to attend, then they're always paired up with a discussion board, and the recording is posted, so then you can still interact with the tutors and with your peers via the discussion board. So it's pretty flexible, and most people find it's not a problem with their days off.
Rebecca, do you have anything you'd like to add?
We don't
or-
have synchronous, well, we don't have the online one. In terms of, no, the learning sessions, they're probably likely to be Tuesday, Wednesday and Thursday. But I don't think the dates have been exactly confirmed for next year. They will be confirmed soon. But yes.
Yeah, the dates are coming out. We're publishing ours. We've all just had to confirm them in the team. And so in the next week or two, our module dates will be published, and the synchronous session dates will be published for next academic year. So you get plenty of advanced warning.
Great. And we have another question that has been submitted. So this is, if you apply now and were accepted, would the start date be in September 2023?
Yeah, I think the certificate, the medical education is probably going to start in early October. But yes.
Yeah, we start early October as well. And we also have an intake in January. So if anyone, for whatever reason, right, so for the health professions education, we have both the September-October intake and the January intake. The other thing just to mention, if you do find that you're sort of out of sync with that process, or if you're really keen to start something early, we do offer any of the UCL modules as short courses. So you can actually sign up to an individual module as a short course, and that you could apply now to do. We divide our academic year into 4 blocks. So the block 4 modules are still available for signing up for as short courses. So if someone was really keen, they could sign up for one of those, and then you can carry the credits from that into signing up for the master's programme. But otherwise, then yes, if you were signing up for the full programme, it would be for September.
And we don't do that for the master's medical education, so we don't do them as short courses that you could do early. So.
Fantastic, thank you both. And just a question from my side as well. So in terms of the assessment methods, how does that work for both of the programs?
So for the Masters in Medical Education, they are written assessments. So I went through I mentioned on the presentation the ones for the certificate, so 2,500 words. It's about learning kind of about academic writing, so they're about kind of critiquing literature, the literature on medical education, and putting together a research proposal and critiquing an assessment. And then there is this one which is about the teaching reports, when you reflect on your practice as a teacher but link that to the theory. So that's what, and then they are a kind of on a similar model for the diploma year, and then it's the master's year when you actually write the long 12,000 word thesis or report.
Ours are similar. So if it's a 15 credit module, then it's a 2,000 word assignment. If it's a 30 credit module, then it's a 3,500 word assignment. And they will typically be examine an area of your practice in teaching and learning, curriculum development, leadership, whatever it is, and using an educational theory of your choice as a lens, critique something about it. So it might be, for example, plan a lesson for or plan a learning episode that you're going to be delivering in the future, explain the educational lens that you're using, theoretical lens that you're using, and explain your choices for the decisions you've made in your teaching. How will you know whether your teaching is effective or not? That's a sort of typical title. There's another question about a link for short courses. I will go and find that resource, and then I will post that. So I'm just going to mute myself for just a moment.
in the meantime, we do have another question. I'm just conscious we have 4 minutes left. So
okay, well, I'll answer that one in that case if you want, because yes, so we do, yes, we offer all the same student benefits as in-person learning. So
okay, perfect.
you can still come to campus, get a student card, and use all of the UCL facilities. That's the same for both programs. So for the medical education program, although your learning will be based at the RCP and you have access to the RCP library, you also have access to all of the UCL libraries, and it's university wide. So it's not just the medical libraries, it's anywhere. So you can go and sit in the history library if you want to.
Thanks, Kerry. And yeah, in terms of the link question, I will just give Kerry a couple of moments so she can find that for you, Shahina, but thank you for requesting that. Okay, I can't see any other questions for now, so we'll just wait to share the link, and we'll give you a couple of moments because we have got 3 minutes left. So if you do have any burning questions, please do ask us any questions at all. We're happy to take them. Oh, thank you. We've got a comment saying the session's really helpful, so thank you for joining us. We're glad it was helpful for you.
Oh, I've just clicked that's on the answer live for the short courses one rather than the link. Hang on, can I post it in the chat? Will that work?
Yes, that will work. Perfect.
Kate, you may have to repost that because I don't think I've got the ability to post to everyone in the
No
chat. I think it's
problem.
only coming to you.
Can hopefully do that. Hopefully everyone should have that in the chat.
Yeah.
Shahina, can you, oh, you can see it, Rebecca.
Well, it says now to everyone that when Kerry
Perfect.
posted it, it just said a host and panelists. So yeah.
Fantastic. Well, hopefully everyone can access that link. I did share earlier some of the FAQs for the health professions education program as well. So please do take a look at those. And again, just to say thank you again for joining us today. We're running out of time, so perhaps we should leave it there. However, if you could let us know how you found today's session. We do have a very short feedback form which will pop up on your browser following today's event. And thank you so much for all of your questions and comments, and thank you to our speakers for an excellent session. We really hope this session has been helpful and will help you in your decision making, and yeah, we hope you have a wonderful evening as well. So take care, everyone.
Thank you, everyone.